is Emily Liu. I'm working as a psychotherapist with child, teenagers, and their families. So I'm here with Dr. Dhingra. He's our psychiatrist. Oftentimes we have questions from the parents regarding treatment or medication. So I'm just here with Dr. Dhingra to clarify some of the common questions that I was asked. So hi, Dr. Dhingra.
Hi.
So the first question is, what's the time that I should bring my kid to treatment?
Well, first of all, we have to understand why a child would need treatment because many a times there are behavior problems in children. School staff may tell you that, you may also see it yourself at home, but not every child needs treatment. And they may need help, which many a times, in most of the cases, is provided at the school level. The role of psychiatrists and therapists comes in when there's something the school cannot do. So that's where we come in, and the school will be able to guide you if, say, there's a behavior problem in school, or if there's an attention problem, there's a hyperactivity problem. But if you yourself see that your child is having a rough time, either because of some mood issues or some other behavior issues, there's no harm in getting an evaluation.
Yes, so we're here to help the family and the school to facilitate the care for the children.
Right. I mean, see, members are interconnected. So if a child is having some problem, parents feel upset too, and vice versa. If parents are having problems, that's reflected in children's behavior. So ultimately, it's the help of the whole family.
Definitely. Sometimes it's as important for the parents to get treatment as for the kids.
That's actually true. Many a times, parents are having a tough time because of multiple responsibilities. You know, they have to take care of finances, kids, their own health, their own life, and
Definitely.
if they get stressed out, and kids are very, sensitive to what's happening at home, so they get affected.
Okay. So what are the common mental illness for children and teenagers?
Well, the very common problems that we see on a daily basis are mood disorders, anxiety problems, and some kids just have, attention problems. And we have to figure out actually what's normal and what's abnormal, because kids are, more energetic
Yes.
than adults. So whether it's a normal, energy, or is it hyperactivity, is it productive, or is it impairing the child's, functionality? So that is our job, to figure out what's normal and what's not. Despite the fact that there's no standard definition of normalcy in psychiatry, we try our best to figure that out.
Okay, so there's no harm to just bring the kid in for evaluation. Then we can tell if it's just hyperactive or maybe there was something else to
Right.
it.
Some parents are scared. They feel that once they take the child to a psychiatrist or a therapist, it's an automatic consent that, child will be prescribed medications, and many parents are against medications. I just want them to know that evaluation is an evaluation. No one is going to give medications to your kids without your permission and without your consent. So the way you go for, like, annual physical checkup, same way you can bring your child for, a session with a therapist to see how things are.
Yes, so being the guardians, the parents are the ones who say yes or no to the medication most of the time.
Most of the time, unless it's an emergency situation where the doctor and other people take charge, but it's your child. So without your permission, no one can force you to give medication to your child.
Okay. What are the common signs of the mental illness that the parents should watch for?
So since there is no definition of normalcy in psychiatry, the way we define abnormal behavior is if someone is in distress. Like, for example, the child is having a panic attack, or the child is so depressed that he or she is not going to school, or the grades are going down. So if there's a distress, and the second thing is dysfunction, that means that the child is not able to function. Other kids are playing, they're happy, and this child is isolated, not taking care of himself. So that's a dysfunction. And the third thing, which is very important, is dangerousness.
Definitely, yes. That's the most important thing.
Yeah, because if a child has done anything dangerous, or even he or she has said anything dangerous, you should not take it lightly, because we see kids all the time with self-harming behaviors. So we should take it seriously and get an evaluation to make sure that there's no serious, real threat to the child's safety.
Yes, so safety is always the most important. And second is about, is the so-called symptom affecting their social function?
Yes,
Okay,
and academic function, and also
definitely.
child's satisfaction with his or her own life. So all these things have to be looked at, and then we can decide if this child needs no treatment, or the child needs only therapy, or the child needs a combination of therapy and some medications.
Yes, and these are all up to discussion. Once you meet with a therapist, once you meet with a psychiatrist, we can all come up with a plan that works with everyone.
Discussion is very important. So if any psychiatrist is prescribing medications to your kids without explaining everything to you properly, like the indications, the side effects, and the duration for how long the medication will be needed, then he or she is not doing a good job. So parents have to be on board. They should understand everything before they give any medication to their kids.
Yes, that's called informed decision making, that you should have all the information before you are able to make any decision for your loved ones.
Yes.
Okay, so if I'm bringing my kids to go to a mental health clinic, is there anything I should prepare?
First of all, know that you are in charge. It's your child. Don't come with fear, because if you're bringing your child to the clinic for the first time, obviously, you'll be expecting that someone is going to be judgmental towards you. The process is going to be complicated, and so many other issues. Um, just come with an open mind and tell the child beforehand that you're just going to talk to a therapist or a doctor, so that the child is not scared, because we see this all the time. The first 1 or 2 visits are like everyone is scared. The parents are scared, the kid is scared, and it takes us time to kind of help them understand what this is. So come with an open mind, come on time, because these evaluations take time. So if you're not coming on time, you lose out on what you can get from the treatment.
Yes, and if possible, it's also better if you can kind of record what are the symptoms you observe before the visit. Because sometimes it's like if you are at a bank or buying a ticket, people get anxious when they are in the visit and they forget things. Then often I heard more things after the psychiatric evaluation that, oh, I forgot to tell the doctor that.
Right. So it's good to do your own research. And many parents have this, thought about, like, what are these medications? What's treatment? What's therapy? What's the difference between psychology and psychiatry? Write down your questions if you think you won't remember, and just tell the therapist or the psychiatrist that these are the problems, but I also have some questions, and you'll get the answers.
Yes, and sometimes just know that having that list in your hand or in your pocket can help with anxiety.
Yes, and also know that your kid is not the only one who's having issues. It's a common problem. Kids have behavior problems, mood problems. So don't feel that you are to blame, that something bad happened and now you are taking personal responsibility. These are common issues. The way you go to a doctor for medical illnesses, you come here to talk to us and seek help. Yes,
and definitely our job is not here to point fingers or to tell you how to be a good parent. We all believe that you are the best parent, that you know more about your kids. So we are just here to hear you out, support you, and give you some professional help.
And if you have any questions, you could email to us, and my email address will be, the link will be there. And we'll try our best to focus on more specific problems in future. This was just more like a general introduction. And we'll try our best to accommodate your questions. So Thanks for
Yes,
listening.
thank you for watching, and our next session will be about meditation. Thank you. Thank you, Dr. Dhingra.
Thank you.
Sure.